life balance. Why we have to talk about this in medicine? Do we have a good reason for this?
Yes.
Stress. Can stress affect our health?
Yes.
Can stress cause heart attack?
Yes.
Can stress increase mortality?
Yes.
Do people die from stress?
Yes.
Can your performance, your medication error, your error in the surgery, or prescribing medication caused by stress? 100%. We see this a lot. So stress is really an important topic or subject we need to talk about. Okay? Because it's actually, you'll see why it's related. Okay, we'll talk about it. I can use this one, right?
Yes.
Now, the real question is not whether life exists after death. The real question is whether you are alive before death. True? You will see in your life in the future. Become a surgeon, in your clinic, primary care, psychiatrist, wherever. You might get really, really stressed out and really a lot of tasks, a lot of demands that you are supposed to do and you don't have time for. So you will have this stress the whole world and you'll be, you are very happy and nothing wrong. You know, your pager, your cellular phone, your WhatsApp, your emails, you are in the third year.
We're having a class.
But I'm saying, if you are in the third year, you have a lot of stress, right?
Yes.
This is one of the, I know, one of the busiest, year in med school in Faisal University. So stress will make you really angry, a lot of hassle, big demands. You cannot really tolerate. It's too many tasks to do, too many things to do, and the time is limited. If you have a manager like this or a wife like this, your life will be stressful. You know Nagi? You know Nagi?
Yes.
You don't have a lot of stress if you have something like this. When I go vacation with my kids and my family, I said, just leave me alone. I don't want to do anything. Just want to have time free. Just looking at the sea or doing nothing, just to relieve my stress. Anyone has this feeling when they go vacation? Oh, everyone. Or you'd like to go to an isolated place where no one can reach you, on the moon, no pagers, no emails, nothing. But Elon Musk now is doing this trips. Now, why stress is important? Because you see, 60% of all illnesses and diseases are related to stress. Can you imagine this? 3 out of 4 doctor's visits are due to stress. Can you imagine this? Now, I'm sure you will go to the ER one day, some of you in rotation, some of you will specialize in ER, or you might be like a primary care physician. So you will see a lot of visits. It's not actually related to an organic problem. It's not, body aches, low back pain, knee pain, a little bit of osteoarthritis, but why you have all of this pain? Why you are not concentrating? Why you have a lot of errors? By doing prescriptions, doing surgery, why you are having all of this? Because of stress. Now the cost is really big. Can you see the number on the screen?
Yes.
How much is it?
$300 billion.
$300 billion, the cost of stress annually in the United States. That's why all governments now, or Ministry of Health now, are kind of addressing stress. Any big organization, they are addressing stress because better, work environment, less stress, more performance, more productivity, and less cost. This is scary. People who experienced a lot of stress in the previous year had a 43% increased risk of dying. It's too much, isn't it? 43% increase? It's too much. But I'll give you at the end. So stay tuned. At the end, we have an assuring message for people who are in stress. Over 20,000 deaths per year, killing more people than skin cancer, HIV, and homicides. So more than a crime, stress is killing people. So if you have a manager causing stress for his employee, I consider him as a criminal. He is. Because he doesn't understand what leadership is. So what is stress? Stress is a psychological, emotional response, a physiological, physical response to a stimuli or a stressor. The result of the stress is not always bad. Of course, you need some stress. You need someone to push you a little bit, so you perform better. You need someone to give you a deadline, so you can perform, you can achieve. That's okay, but it's not always the case. Why is stress? What happens with the stress? We have a stressor, right? And then we have the fight or flight. What does it mean? When you see a lion, you feel happy, smiling. What do you feel?
Fear.
Your blood pressure will go up, your palpitation, sweating, right? And what? With your pants? Sometimes, right? With a lot of fear. Yes. So, is there flight, fight or run away? So the physiologic response, it's actually, preparing you to either fight, face, or run away. And then your cortisol, your adrenaline, your epinephrine will go up in your body to cause all of this, to prepare you for fight. So body is ready to respond now, and either physical release, and you either fight or you run away, or no physical relief. So you have stress after stress after stress, and your body will get tired and weaker and weaker. Your immune system, your cardiovascular, circulation system, your renal system, your everything will get really tired. Stress and performance. If you don't have stress, you become like boring, right? You don't have big activity, you don't have a challenge, you don't have anything to perform. But you have, stress and you are performing and performing. We have a peak of performance. You have a peak, you have a ceiling of performance. Now, more stress, my performance is the same. More stress, I become into downgrade in my curve of performance. So my performance will go down, I'll get fatigue, exhaustion, ill health, and then burnout. Burnout is like really bad. When you see someone is burned out, it's really bad. And I see them in my clinic, I get burned out sometimes. It's really a bad situation, concentration, memory, whatever, performance. Can stress affect the exam? You're writing down and you get stressed out. Someone around you asking you, are you cheating or not? You're stressed. You don't forget what to write in the exam, right? So stress is really important for our concentration, depression, and anxiety. About cardiovascular, we talk about it. Hypertension, MI, cardiovascular, joints and muscles. So many times I have patients, with body aches. It's a stress. Tension, headache, stress. Immune system, for sure, your immune system will go down. Skin, hair loss, brittle nails, dry skin, acne. It's really very common. And they got nutrition. You get like diarrhea, constipation. You see people with IBS, right? Irritable bowel syndrome. Yes. It's always about abdominal pain, floatness, constipation, diarrhea. Nothing wrong. You do colonoscopy, CT scan, everything is fine. The only problem is the stress. Reproductive system, decreased hormone, decreased libido, erectile dysfunction. This is also a very common. So where the stress coming from? In any organization, and you as a student, you are working here, right? You're an employee. So demands, when demands is really exceeding your ability, you'll have stress. Control, are you in control or not?
No.
About your exam,
There is no control.
about parallel courses, this is really important as a stressor. My son actually is studying not in Saudi Arabia, it's in somewhere else. He had the control in his exam. He said, I never did an exam where assigned to me. I always make it a little bit earlier or a little bit later. That's fine, why not? Why not you don't have control? You know, the time is not good for me. Okay, when do you want to do it? Next week, that's fine. Support, do you have support in your work or not? This is really important. You have someone to stand behind you. If you do a mistake, if you don't come late, or if you do, an issue, life-wise and work-wise. Relationship, do we have a healthy relationship or not? Your role, you know your role in the environment, you know your role in the organization or not. This is really important. Change. We love the comfort zone, right? What's the comfort zone? The zone that we get used to. Any change, even if it's good, it's become life, stressor for you. And I'm sure this maybe if this is new for you, this one, this room for you is new. You don't feel comfortable like the one you got used to, the place you used to sit with. It's important. Moving to a new place, to a new town, a new city, it's also important. A big stressor. So common stressor in the workplace, rigid work practice, poor communication, non-supportive culture, role task ambiguity, uncertainty, conflicting demands, lack of participation, bullying, harassment. Lack of participation, if you want to kill someone who's talented, he can give, he would love to give, he would love to participate, and you don't give him participation. This is big stress factor. If you want to kill someone like this, just sit him aside. Don't give him any task or any work, job. It's really killing. Be careful, guys, especially Saudis here. Because one day, inshallah, you'll become a supervisor, a manager, a CEO, inshallah. Please remember this. Please remember this. Be fair. Get the stress out of your thinking. Leadership is helping others. Leadership means create a nice relationship, a nice environment, a supportive. So why stress cost is too high? Because 90%, this is one of the studies, 90% of absenteeism, people get the sick leave because of stress, 40% turnover. You know what turnover means? For the same job, you quit and then another one to fill the job. And then he will quit after 6 months. Because there's too much stress. It's not happy at all. 30% of a short and long-term disability cost, 10% psychotherapy dogs, 60% workplace accidents. Imagine this, 60% of workplace accidents due to stress. This is very costly on the human cost and for the factory or the organization or the hospital or whatever. 100% of work compensation loss due to stress. Major factor of production loss due to presenteeism. What does it mean? Yes. Leading cause of unscheduled absence. See? Let me go this. Now, when you have a stressful job, not healthy environment, you talk about all this, like less productivity, poor safety, staff compensation, the morale will go down. When the morale go down, do you think you will have better performance or no performance? You just want to go and come and taking my salary, goodbye, and not happy. I will find another job, I will go and find something else. But the other way, your morale is high, even if you have a lot of work to do. I'm happy here, I should give more, I should do better, I should be creative. So you think about research, you think about to improve your job, to improve the, how we do better productivity. So that's why it's really important to address this. That's why they address this now everywhere. Work-life balance is really important. Now, when I receive, a job seeking, advertisement through my email, they said, this city is really nice and this and that, and they write down work-life balance for me to attract me to go and work there. So this is really important, and people are looking for this now. So we need this balance, and we talk about it why. A better work-life balance, being able to meet both work and personal commitments, increased sense of control. I know a lot of my colleagues, me included, I cannot, many things I will delay it until I get vacation. So vacation should be like my good time for relaxation. I go and do things that I couldn't do because of the too much work. Greater job satisfaction, being able to remain in the workplace longer. We talk about this in another article. So you will have a good life balance and a good stress level. You can have more engagement at work and better productivity and increase profit to the organization you are working with. I think we talk about it. So what we can do in workplace, and I'm sure you're a physician, some of you might go for occupational, so might come to this, or become a manager or CEO. So always keep in mind flexible working hours. You don't have to come on time. You can come 2 hours late and leave 2 hours late. Print, fingerprints. You know fingerprints?
Yes.
You do this here?
No.
No.
I do attendance.
So flexible hours. I trust my employee. They can do their job either at home or here. They can do it remotely. My daughter works in Chicago in one of the big companies of interior design. She can come 2 hours late. No one will ask her why. Or doesn't come. She said, "I'm doing my work at home." That's fine, no problem. So it's flexible. You feel that you're not, handcuffed. Part-time work, you can do this. Variable years employment. Leave should be easy and easy to have. Working from home, I said, I talked about this. Job sharing, so you can tell your colleague, can you see my patients today and I will see your patients tomorrow, so I can have one day off? Yes, why not? Or you do the attendance for me today and I will do the attendance for you tomorrow. Now, how you can help stress? Stop and breathe. Have some time, stop during the daytime. Do nothing. Close your eyes. Take a deep breath. Okay, relax, breathe. Think about something good in your life. I told one of my patients while doing procedure for him, I said, okay, now just relax, think about something good in your life. He said, I have nothing good in my life. What do you do for this guy? It's difficult. Make a cup of tea, a cup of coffee, whatever it is. Give yourself a break. Move. Sports, exercise is really always good for you guys, especially now in the third year and then during Al Faisal university time. Play some music, find person you like and give them a massive hug. Can hug help? A lot of studies showed a hug every day will reduce your blood pressure. More hug, more relaxation. Hug your mom, hug your kids, hug your one day I was actually in New York. Anyone visited New York? Did you see the Hugging Square? Hugging Square. Hugging Square, there are people. They held a sign. They said a hug for $1 or hug for $2. And I thought it was a joke. The lady, the tourist lady, she told me, no. Those people are actually here for hug. Maybe someone lost their job, stressed out, So they will go to that Sequoia and they hug for $1. I don't know how, 1 minute or 2 minutes, but you can extend it. You give them $10 until you feel better. So they go, they found the big leap, hug will be better, right? You will sink and feel better. Now turn off take your phone, your WhatsApp. You know, people now, they send each other flower, right? Excuse me. Send them heart. I want to hear it, right? Like Nabi sallallahu alayhi wa sallam. One of the companion came to him. He said, the Prophet of Allah subhanahu wa ta'ala. He said, Prophet of Allah, I love that companion. He said, go and tell him. Spreading the nice environment, the compassionate environment, the good relationship between people. That's, I want to say that الدولة الفاضلة, So this is nice, If you like someone, go and tell them. The problem in our, culture, we don't express ourselves. Like in the US, it's easy to say, I love you. Here, the wife, it's really difficult to tell her husband, I love you. We don't know why. Here, even the husband, it's really difficult to tell his wife, I love you. Or say them, I love you during the daytime. We have this problem. So how we solve it? Start the tick. Tell your, anyone whom you love, I love you. Slow down. This is something I really have difficulty. I cannot slow down because I have too many things to do. But we have to. Spend time on your passion. Anyone has a hobby? Yes. Anyone like painting pictures and sports, and poem. So use it. It's nice. Make sure you sleep. Sleep is always good. You will reduce your cortisol, your epinephrine, your adrenaline. Why hug is good? Why love is good? We enter the effects of our hormones, right? Cortisol, epinephrine, norepinephrine is what? Stress hormones. What does it cause? Tension, prepare yourself, increase your heart rate, increase your blood pressure, right? What oxytocin? Relax. Feel good. Dopamine. What's the difference between dopamine and oxytocin?
Dopamine is motivation. Oxytocin.
Love bonding.
Oxytocin is the happiness. Dopamine is the addiction. Addiction. Now, who feel happy? The giver or the taker? No, the taker will feel enjoyment. Okay. There is difference between joy and happiness. This is dopamine, this is oxytocin. Now, a lot of studies actually says that's why we're going to ask our patients and ourselves. Now, pleasurable behavior reduces stress via brain pathways. A lot of research are actually confirming this. So you need to counteract your stress with the pleasurable things. Like food, love. Food, not this food. Okay, you are a physician, right? So you look at this. Yeah, this is protein, this is, you need the protein, you need the vegetables, Why you don't make it like this? It's a big difference, right? So you need your eyes to work, and your taste, and your smell. Now your food like this, or like this? Anyone gets alone, away from his family? Some, right? I'm sure your food like this. Yes. McDonald's نفس الحال. Dark chocolate is good. Fragrance is lavender is good. Any good smell is good. That's why it's it's a duty Prophet Muhammad sallallahu alaihi wasallam said, it's واجب على كل مسلم من وجد طيبا أن يطيب به. والله this is nice. والله in Switzerland don't see يعني a way of life like Islam. SubhanAllah. Fresh tuna steak, a lot of studies says like it will reduce your stress and give you this pleasure and counteract your stress. Funny movie is good. A good friend, funny friend is really good. It's always nice to have some support, someone to talk to, someone to relieve your thoughts, your bad thoughts. While get away from the toxic people. Do we have toxic people in the life? Unfortunately, yes. But not too many. Not too many. Not too many. What's the treatment for toxic people? No, leave them alone. Leave them alone. What's the behavior of toxic people? You are always wrong. Right? You always miss good things when you are not there. Right? You make a lot of excuses. Get them away from your life. Be careful when you get married. Get away from toxic people. Chair massage is the key. I think the assessment office will have something like this. Very soon. Nature. Have some time, go around, some green stuff. Inshallah, Saudi Arabia will become like this and beyond. There's big plans to become like this, inshallah, in the next several years. Your age does not mean you don't have a good, compassionate relationship with your husband. A case like this will help a lot, but not from this woman, of course. You remember this scary study that we talked about?
Yes.
Right? And I told you there's something assuring at the end. So it says actually people experience a lot of stress in the previous year had a 43% increased risk of dying. Too much. Do we have hope about all of this? They did a study actually. 182,000 patients who had a lot of stress. They estimated that over the 8 years they were tracking death. For 182,000 Americans died prematurely, not from stress. They found it's not stress itself. It was actually from the belief that stress is bad for you. I was this example, not to show off, but to tell you about how you deal with the stress, how to make it, something good, not bad. I see a lot of patients in my clinic. I see like 2-3 times sometimes the number of patients that the physician can see. But how I look at it, I'm helping people. I'm receiving alhamdulillah prayer. This prayer will help. I see the good smile on their face. Wallahi, this is very assuring. And very assuring for me. And help me a lot with my stress. And I look at my stress, it's a bounty. It's a grace from Allah subhanahu wa ta'ala. I have more people now today to pray for me. If you look at it, come on, get out from here. I have enough patience. I have schedule. Go and make another appointment with me. Take it in a nice way, in a good way. Everything in your life, think about it this way. One day, I forgot his name. Now he said I was walking on the seaside, and a newcomer to the city stopped him. He said, "Hi, how are you? Yeah, I'm a newcomer here. So what are you doing?" "I'm fine. I just want to ask you about the people here in this town." He told her, "How's the people in the town you were in, or you lived in?" She said, "The people were really ugly. They are really bad. I don't miss them at all." And he told her, "The people here are the same." He said, a few years later, another lady stopped me at the same conversation. She told him, "How's the people here?" He told her, how's the people where you used to live? And she told him, very nice people. I really messed up a lot. I wish I did not leave my little town where I used to live. He said, the people here are also the same. So it's not the others. It's you. How you look at things, how you look at your colleagues, how to look at life. Clean your mind, clean your heart, clean your spirit. So this is not funny. This is not funny. This is serious. You might spend your, I'm sure, a lot of time in your life to realize this. Anyway, so they found actually people who look at stress differently in a positive way have less mortality. Even if the stress is less with the people who look at it, this is bad, this is ugly, this is, they have better mortality than those. I do love my job. I do love my King Faisal Hospital, where I, work. Although it's really stressful, we can't be like this, and especially you guys when you become, inshallah, leader, you should have your team like this. Never get so busy making a living that you forget to make life. Allah Rasul sallallahu alaihi wasallam said, إن لجسدك عليك حقا وإن لأهلك عليك حقا وإن لربك عليك حقا فأعطي كل ذي حق حقا. A balance in life, a balance with people, a balance with environment, a balance at work. I always tell my patients, خير الأمور أوسطها. Don't be extreme, even in your love. Don't love like a قيس ليلى. There is no قيس ليلى. You become مجنون ليلى. You become مجنون. Take it easy. A balance, intermediate, and average of everything in your life. You will spend your life beautifully, peacefully, and smoothly, inshallah. Thank you very much. To see you, inshallah, next week.
Thank you, Doctor.
Okay, final thing before we let you go, inshallah. This is the second case for occupation medicine, which is gonna, Dr. Amin started kind of today's kind of the introduction of occupation medicine. He loves giving the relaxing lecture at the beginning. Hopefully to prepare you what's to come. But this will be the last case in occupation medicine. From next week, we'll inshallah take advantage of the time after and before his sessions to discuss the project that we're talking about, inshallah. We're finalizing the final details. So for this week's case, it's a little bit more, last week's case was a bit more about why it was happening. This one is more about what to do about certain cases, and you'll see what I mean. So this is also a true case. It's not a very interesting case. It was just part of a manual of cases, which is about how to deal with occupational medicine cases. In this case, there's a lab technician, 31-year-old female lab technician. She came to you, and you're an occupational physician. You're not just a primary care physician, but specifically an occupational physician. And she was sent by the manager, and this is something that happens in North America, where you can be referred to an occupational physician as part of maybe poor performance, as part of your evaluation, whatever. In this case, she had some poor performance or evaluations, and thus she was sent to the occupational physician, which is you. And she's having poor performance, and she kind of is dozing off at work. She's not completely 100% active. You interviewed the patient. The patient said that she's been having trouble sleeping, specifically mostly due to really bad cough at night that comes to her at night. And she thinks it's because of the lab is very cold. It feels drafty. Drafty is kind of like what you feel sitting under the AC vent. Just a lot of, it's just drafty. Also at the end of the day, she feels like her right arm her right arm is painful. And it's kind of tense, and maybe she says that's the reason why her performance isn't as it should be. She's not meeting her targets, etc., etc. And of course, when she told her manager, he was, very dismissive of her complaints and unsympathetic, as unfortunately some managers are. Since this is recorded, I can tell you that I'm very happy with my manager. And you know, she told her if you don't like the job, just you know, you can leave and all these things. So, what do you think is wrong medically with this patient? What can you classify as a medical problem in this patient?
Anxiety.
So anxiety / stress, right? Like under that umbrella. Sure. What else?
Depression.
Wait, the question is, why are you sitting so far? I mean, you look like, you know, when someone invites people to food and he sits at the head of the table, you kind of have that, you know, atmosphere to your why you're sitting. So what did you say? Can you pass what he said to me? Insomnia. Sure, that's definitely what she has. She definitely has insomnia. What else? Yes.
Depression.
What is it?
Depression.
Would you call it depression?
Not yet.
I mean, based on her complaint, does she sound depressive? Can it lead to depression?
Yeah.
Sure, but I mean, I wouldn't say she's depression. She would have mentioned it, and she didn't. And based on your observation, she seemed fine. She's quite active after work. It's not terrible, yeah.
Possibly burnout.
Possibly burnout, which is, I mean, burnout is kind of mixed with stress and anxiety, and I agree with you. Work burnout can definitely be an issue. Yes.
Right arm pain and coughing.
So the right arm pain, what do we call that? No. No, don't use the PPL case this week. And shout out to my PPL group, they're sitting almost together. Oh, mashallah. Also shout out to the guy who tried to sell a cab, but it's okay. No, not claudication. Have you heard of repetitive strain injury?
Yes.
This is when one said yes. Okay, what is it?
Strain.
When you keep doing similar motions all day long, you get repetitive strain. Like what? Typing. Most common thing is typing. What does a lab technician do a lot? Anyone here did any lab training? Prepare slides? I mean, that's not really repetitive. What is the pipetting? Have you seen the pipetting thingy? You know, so you know, have you heard of trigger finger before? If you overuse your, you know, you can get because overusing it. So we call these repetitive strain injury, and you know, can happen from repetitive use of a limb. Any other example other than typing and pipetting? Yes. Sure.
Maybe swimming.
Could be swimming. I mean, a lot of mostly sports. Let's call it sports. Sports. Each sport has. Have you heard of like golf elbow and tennis elbow? And they're named that way because it's common among those athletes. What else?
Surgery.
Surgeons do actually sometimes have some RSIs. Yes. Carpal tunnel from typing. Sure. The clapping guy. Same thing, sure. Carpenters. Anyone here has a family member who sews, like cloth?
Everyone.
And this can actually also a very common cause of repetitive strain injury who sew. So, any other medical problems she can be having? Yes.
Doctor, I have one question.
Please.
Is it possible for the surgeons to have it?
Yes. Someone just mentioned it. Yes. So surgeons can have it definitely. But what about her her coughing? What can be causing the coughing? Obstructive sleep apnea, you mean? I mean, she's fit, not that, you know, overweight, unlikely, yes?
I think it's a lung infection.
What lung infection are you worried about?
They said it's cold and drafty in the lab.
Sure. Okay, so you're a third year medical student, right? You realize that cold temperature doesn't cause infections, right? You don't realize that, you don't know that yet?
I mean,
This is only a Syrian thing, by the way. I feel like you're Syrian. Are you Syrian? Yeah, I feel like that's a Syrian. I mean, a lot of Arab countries we have the same thing, but that's specifically where, like, if you go out in the cold, you get an infection. I mean, infections are more common in when it's cold outside, but that's not because it's cold; it's because of the season. Maybe cold decreases your immunity a little bit, but then again, people who live in cold climates don't have more infections than people who live in hot climates. It's just seasonal more often than not. So you can sit under the AC the whole day; you're not gonna catch the flu nor had pneumonia like some people think. So, I mean, it's good that we're discovering these things because you're third year medical students. It gets scary next year. Now it's fine. Next year, yes. What is it? Allergies, sure, but I mean, like last week's case. So let me try to connect things a little bit. Can, you know, because it's drafty, meaning that most likely it's very well AC'd wherever she is. Can AC specifically cause something that can cause the cough? Not chest infection. Not dust. Who said dry what? What did you say?
Make the airways more dry.
Dryness, actually, yeah. So dryness can alone cause a lot of coughing and people complain. Anyone here used to live on the sea? Like seaside, coast? Did you face any issues?
No.
Obviously you clap more now, but any other issues than that? Nothing? Anyone who used to live at like in a humid area moved to a dry area and faced some issues? What happened to you?
I guess congested a lot.
Yeah, and because your body's trying to, you know, kind of compensate for, and congestion alone can cause coughing and all these issues. So I know a friend, which is an extreme. He moved from the shore, basically from the seaside, to Riyadh, and he spent the first 2 weeks in ER. I still remember I used to drive him there because he had no one else. I was in med school, so that wasn't exactly fun. But I used to drive him there for almost 2 weeks. So at his home, we set up 4 humidifiers. It was like he was, you know, he was growing something there because like it was so humid, and it was the only way he could survive. And at work, he had a humidifier that blows directly into his face. Because if he leaves his desk, he starts coughing and he's short of breath. He has to sit down. So dryness can be an issue, not to everyone, but to a lot of people. And of course, any area that is artificially cooled can cause the issue. So, sure, that's, you know, that's basically what it is. These are the medical issues. Now, my question also is that, you know why a lot of areas you work / study are cold? Anyone feels cold in this classroom?
Always.
You know why? Anyone asked the question, why don't they make it warmer? Even in winter, who said it makes you up? That's correct. So studies have shown that at this part, you know, coldish temperature, not very cold, coldish temperature makes you more alert and more productive, which is things any company cares about, yes?
Wouldn't it be the opposite?
Good question. Some people, but not all. In fact, you get sleepy if it's cold and you get warm. Think about it. If you're cold, you're not comfortable enough to sleep. But if it's cold and then you get cozy, that's when you're sleeping. So now you're wishing for a blanket, but you don't get a blanket. You know, if you do, sure, you'll get very sleepy. So the studies have proven that they increase productivity. And of course, companies they can spend millions to work on, especially big companies. You know, they don't mind how much spend because even a slight increase in productivity can save them $1 million over the year. So that's why in a lot of places it's never too cold. It's always just cold enough to make you annoyed. Have you noticed, like, go to any office, it is just cold enough to make you annoyed, not shiver. Because then if you're too annoyed, then you don't work. Just cold enough. And that's why there's no controls anyway, by the way. You don't get to control the temperature in most corporate environments / So in this case, and we'll talk about what we can do in this case later on. How about her? Okay, let's talk about what can we do to this patient. You as an occupational physician. An occupational physician is basically a person in between an employer and an employee. What can they do? What can you do in this case? Now we kind of know what's going on. What is it?
Give her a break, 2 days off, 3 days off.
I mean, you're not solving the issue. You're kind of putting a band-aid on it. I mean, she's gonna go back and then same thing. You can't do that. You know, as long as it's reasonable. I mean, what can you do to kind of make sure that this is happening? And we discussed it last week as an occupational physician. Yeah.
Her boss.
Talk to the boss. So I'll go to the work, you know, the workplace. Go to the workplace. Make sure. And how do you make sure that it's not too cold?
Ask,
Other employees.
Yeah. So it's very important to ask other employees. So if you did ask them and they said the temperature is fine, what would be suspect in this patient? Hypothyroidism. The girls call it on a meet, like one of their first thing they mentioned, like we should check for hypo. So you should check for hypo in this hypothyroidism. Another thing is something I trailed off when he said infection. Someone who works in a lab, what are you worried about? And he has night cough every day. Tuberculosis. Any healthcare practitioner with a permanent cough, you immediately rule out. In this case, they ruled out both hypothyroidism and they ruled out TB. So what else can you do for this? So you went to the workplace, it is not too cold. It's not miserably cold. It is within degree, and by the way, there's a standard. I think it was like, don't quote me on this, 23 degrees Celsius or something like that. What would you do? Advise, if the temperature is reasonable in the workplace, advise your patient to wear more clothes, which is a very reasonable approach. A lot of ladies jump to like sue the employer or stuff like that. I like that reasonable approach you're having there. Let's see if we have what else can we do for her arm, for example? Would you do painkillers? I mean, general rule in medicine, if you cannot remove, if you can remove the cause, you shouldn't just medicate the pain and then leave the cause. Sure, if you cannot, then you don't have another option. What can you do?
Stabilizers, they check.
So there's options, there's ergonomic options that can help her with her job. There's even, by the way, pipettes that are lighter, for example. Even that is an option. Okay. Any other things you can kind of tell me about? What can we do at work to improve this kind of ergonomics? We call them ergonomic factors. Chairs are like the most commonly mentioned in any office space, and I'm lucky to work in a place where they actually care. Like our chairs are incredible, by the way, but they're like $1,000. Like
Where are they?
like good chair in our office, and they're locked, so you don't need to worry about it.
The chairs of the library. Oof.
So we have like the chairs are like $1,000 per chair. Now my question, if you own a company, why should you buy a $1,000 chair? If you have 50 employees and you can buy them $50,000 worth of chairs, why should you do that?
You don't get students.
Why?
They're comfortable and because their productivity is long term.
So that's one thing. It's proven that a more ergonomic chair actually saves money on the company. Like these things, have you heard of the term return over investment? So whatever any company that spends $1 wants to know that dollar how much money will it bring back. It's a very complicated thing to figure out, but there are studies to do so, even in medicine, because at the end of the day, money is an issue anyway. And in medicine, in companies who hire an occupational physician and they take care of these things, they actually know that if you buy a $1,000 chair, it returns like $1,200 from productivity, increase in productivity alone. Another thing a company should be interested in providing these ergonomic things for their employees, other than increased productivity.
Prevention.
What is that?
Prevention.
I mean, sure, but why? Why do you want to prevent it? Other than, one of them is of course to improve their happiness, which as Dr. Amin showed you, definitely has been proven that increases productivity, increases case of employee participation, even willingly in things that he's not required to, all these things, yeah.
If they have better chairs, they won't have more back pain. They'll take medical leaves for it.
So that is under productivity, but I like that. It also decreases leaves. So that's very important because they're allowed to take leaves, and that drops productivity. Even if it's unpaid leave for a company, that's not a win. If I don't pay you, you make money for the company. That's something you need to put in mind. There's a study, for example, that showed that companies who give the flu vaccine, which is in the US is a few dollars, it actually returns like 10 times what they spent just on decreasing leaves, because they either don't get the flu or they get it mildly, so they don't need as much time off. So that's like an example.
Breaks.
What is it?
Breaks.
What do you mean breaks?
Like you give the employees.
Sure, that's also calculated, by the way, on how much and how long. The very important thing, especially in North America, is insurance. If your employees are better taken care of, they ask less money from you for insurance because they know they're not going to get injured as much. In Saudi, they don't, like in US, by the way, they do competitions for employees to stop smoking. They actually give them prize money if you stop smoking. They do competitions to lose weight. They would actually, if you're willing to participate, if they take your permission, and they will weigh you, and if you lose weight, they pay you.
That's a really good idea. We
It
should
is.
start that and apply for it. I think
I
we should
mean,
start.
we're not gonna fund students losing weight. It's up to you. You're gonna be physicians to be. You should, should know this on their own. But they do pay people to lose weight. Here, companies, insurance companies don't, they either ask like for your average BMI of your employees and all these things. Here they don't. But even here, if your employees are more prone to injury, at the end of the year, the insurance company will look at your cost of care and they see that's more than what you pay, they'll increase your price. It's as simple as that. So this is how I want you to think, is that it's win-win for everyone. It's not just because we love people, and sure, of course, like we physicians specifically, but a lot of company owners, they don't care, honestly. So it's your job to raise awareness on both sides, because it's a win-win for everyone involved. Now, you know, if you go to the boss, what would you tell the boss? Can you go and tell the boss about, you know, what medical condition the employee is having? Why not?
Because patient lost your confidentiality.
So what can you do?
We can go tell him, you know, I've noticed some work hazards such as the AC, such as the chairs. You can do this, you can do that.
I mean, a lot of times they're required to know why. What is it causing?
cost benefit study.
It's actually a very simple answer to
You
this.
can ask the patient.
Maybe you're not the
to
one
tell
who
them.
tells the boss.
No, you can tell them. Tariq. No. If he sent the employee, he knows what the employee is. An employee that I've sent, you know, that I've seen, no, he sent the employee, he knows.
Take consent from the patient.
You
tell
take
them.
consent from the patient, that's it.
Yeah.
So it's part of any, this is a very important step everyone forgets. And people lose licenses over it. It's not a joking matter. Even if it's as simple as, oh, your employee is getting exposed to, you know, to overuse of their, you know, their muscles, and thus they're having, even simple as repetitive straight injury, people can be sued and they can lose their licensing over you know, disclosing such info. So you take permission, you know, to the employee, telling them that this will benefit you. I'm not going to tell him because this, you know, it's going to harm you. I want him to change what they're doing, and I'm going to use your case as an example, and then you can tell it to the manager. So your job is not to side with one side, as long as both sides are reasonable. As an occupation physician, and I know some of you, most of you are not interested in being an occupation physician. I actually did occupational medicine on an assignment. I was assigned occupational medicine in a company, and I did it for a while. It was very interesting, but I can see why a lot of people not be interested in it. But your job is to be in the middle. Now, if management is being stubborn, they don't care about the win-win, all they care about is just not giving that, not doing this, then definitely your job becomes to stand with the patient. Whatever they need a report to sue the employer, then sure, you give the report. So you're not hired by the employer to stand with the employer. You are a physician, and you still abide by your physician duties, your you know, Hippocratic oath, and you know, you still, even if you're hired by the company, you are in the patient's side and in the middle, as long as everyone is reasonable and willing to find a way. So in this case, yes, Tariq.
So she just had like a bunch of work-related problems, not like a single visit.
So if you notice, it's nothing majorly medical that requires intervention. And some female on the female side asked, what can we do medically? In this case, nothing. It seems like she doesn't have any major issue. Like for example, one of the females asked, oh, does the arm pain affect your daily life? And the answer of the patient, I remember reading the case, she said no. Because once I rest for a few hours at home, it goes back to normal, and then and she's active, she does, you know, she does a lot of activity. So it's not affecting her daily life. But if this prolonged, it will affect both her work and her daily life. So at this point, early on, this is where an occupational physician specifically is meant to intervene, to prevent further injury and prevent lifelong debilitation and prevent, you know, complications that will require medical intervention. Because the truth is, I've worked, I was an intern, part of, getting a medical degree, and I rotated in orthopedics for a while, under surgery. And an orthopedic surgeon once told me, he's like, okay, this case can be treated medically, conservatively, or surgical. Like, both are viable. I chose surgical, and I'm like, why? Because that's what I do. So you don't want the patient to end up in a biased opinion situation. Not all orthopedics, some orthopedic surgeon would do surgery at the end, but unfortunately there is some bias, and you can see this in studies. So your job is to prevent as much as possible any intervention needed. And this is a perfect case where it was very mild. It's actually a very boring case. But it's interesting because it's a kind of a standard of what a occupational physician is supposed to intervene, where he's supposed to put his input in. Sometimes, as I said, when I did the assignment, I was, I assessed the chairs, and chairs have their own assessment, by the way, and you can find it online. I assessed the temperature of the workplace. I assessed the humidity of the workplace. All these have standards to prevent any problems in productivity and patient's health. Is that clear? Is that clear why it's a win-win to decrease the stress of the patient? And of course, stress causes everything, like Dr. Amin said. It causes the insomnia that the patient is having. It can even cause, other issues that the patient doesn't even know about. So alone decreasing stress and work environment will help everyone involved. Is that clear?
Yes.
Any questions?
No.
This is an example, it's a very good example of what an SAQ could be. Very general questions, you can see the questions written. Very general questions, very general answers. And, if it's justifiable, again, we are willing to work with you to give you the grade. And I promise you, sometimes you give me answers that are not easy to justify, but I usually sometimes find a way. Sometimes it's hard, but I try my best to, I put myself in your shoes and I start making up why you put that answer, and if it makes even a little bit of sense, I see Tariq laughing there because I think like you're that guy, I think you're gonna give me trouble. I feel like, I don't know why, like, doing your paper. So as long as, it's justifiable, makes sense, you should get the grade. And you see the questions are very general. I'm not asking you to point exactly 3 points or what is the number one. I don't usually do that in SAQ. We do that in FCQs where, you're supposed to give the best answer. In this case, it's not about the best answer, it's about the possible answer. I want to see what's your thought process behind it. This is one example. Of course, usually there's multiple SAQs. There could be an SAQ that is purely recall. That's fine, that's not part of what I do. I'm saying my SAQ, if I'm going to put an SAQ, it's going to be similar to this case. It's very similar to the way the questions are asked. Is that clear? Yes, sir?
And this is not a differential diagnosis, this is just one medical problem in the state.
Yeah. So this is even easier because there's so many, and but of course in the exam it will not be this general. Like I will ask, please mention 3. So I don't want you to guess how many you're gonna mention. And I'm not gonna say mention all. It's gonna be mention a specific number, and you should, or 1 or 2, whatever the case would be. I would expect you to come up with something. You have a question?
Doctor, what's the percentage of the SAQ and the MCQ?
I don't remember.
Doesn't say
I don't remember. They. What was it?
20.
I don't remember, to be honest. I mean, we'll tell you this at the end. Because, I don't remember exactly. I think we decided it like just before the exam last time. It depends on how many questions we feel like we can put. I think it's more. I think it's more. I don't think it's that. Anyways, we'll see. I don't see why you should worry about it from now. And the thing is, your average, at least from previous year, the average SAQ grade is usually higher than the average MCQ grade. So if we change the percentage to higher SAQ, it's usually better for you.
Are you sure?
But this you get more grades on than RICO. I know this. I correct them. I was a student and I used to think this way because I was a student. I used to hate the SAQs. But the truth is that it usually helps you more than damages you. Way helps you more. I've seen people mess up in MCQs to the point that's unbelievable, and then they take like almost full grades in SAQ. I've seen people that if their SAQ accounted for more, they could have passed. The truth is, I know it is scary because you don't know what to write and you don't know where to start. And that is the culture of MCQs, but that's why there's SAQs, because we want you to think in this open mind mentality, this different approach, go from anywhere. And the fact is, it's not one doorway, it's multiple. That's why it's easier. So this, in fact, I tell you, this is usually the highest grade we give on these questions, because almost everything you write is correct. If I want to make it harder, I would specify the question more. The more I specify the question, and the more narrow your basically answer index is, the more likely you're going to mess up. The more general, the more I'm going to be willing to give you the grade. Even sometimes I correct SAQs for different subjects. And this is true. If they give me 3 answers, because sometimes I don't know what the answer is, like they give me the answer key. Sometimes the answer key is literally 2-3 options, and sometimes it's like a page. Guess which one you will take better grades on when it's a page, because you literally have all of these things to get it right from. So don't worry about it. I promise you. I used to be a student and people promised me the same and I didn't believe, so I know you're not gonna believe me. I mean, it should be fine. Anyways, any question, guys? So I'm gonna take attendance again, whoever didn't take attendance the first time. The rest can leave. Thank you so much, guys.